Here's a really good question about anesthesia. And I know you've made a lot of videos too about anesthesia and like
Mm.
the different options and stuff like that. So this is right up your wheelhouse. It
Yeah.
says, what kind of anesthesia did you get during implant placement and FP3 right after? So
Mm.
FP3 just means like the traditional teeth that we do after this that have gum tissue and the teeth all in one. Were you under anesthesia all these long hours while procedure was performed, getting nervous as my day coming?
Yeah, fair enough. So there's a lot of ways that you can have, and I'm going to differentiate between anesthesia and sedation. I'm just going to say sedation because anesthesia can also
Yeah.
just mean the numbing. We do that no matter what. You're going to get numb. We're numbing up everything, so your body's not feeling a whole bunch of pain or anything. But sedation itself is how we're making you feel comfortable throughout that procedure, right? And there's a very wide range of what that can be, right? So on one end, you have no sedation at all. We're just numbing you, right? And as we kind of go along that spectrum, there's another level where we're providing what we call anesthesiologist. So this is like a triazolam or halcyon. It might be something like a Valium. People are pretty familiar with. This it's for the purpose of taking the edge off. It's going to make you feel a little bit less nervous about the procedure, but generally you're going to be very awake. As you go along further, you get up to like a moderate oral conscious sedation, where we are giving you a stronger dose of pills, basically with the intention that you're going to essentially fall asleep and have a lowered level of consciousness, but still be responsive to verbal stimulus. So if I'm talking to you and I say, hey, could you open up a little bit wider? You're kind of in your own world, but you can hear me and you're going to open and things like that. And then we get into IV sedation, which is a similar level, but now we have an IV in. We're keeping you on a constant drip. And so we're keeping you right there locked in. There's not like a dose dependent thing where you take a pill at 8 a.m. and by 10 a.m. it's starting to wear off and you're now a little bit more awake on the tail end of the procedure. We're just keeping you on that drip until we're done. And then finally, kind of at the optimal end, and this is really what's perfunctory in our offices, is we do general anesthesia. So with this, we have an additional provider that comes in, they put an IV in, they get you completely asleep. They will establish an airway, so they're making sure that your breathing is going to be controlled throughout the process. You're going to have, as much oxygen as you could possibly need to keep your, brain nice and healthy. We're monitoring your vitals. I mean, we're keeping you as healthy as you possibly can be and stable throughout the entire procedure. And this is something that we do because it's a lot better for the patient. You're not going to have any recollection whatsoever. You're a lot more stable medically, so we don't have to be as concerned about that. We have a whole nother provider that's making sure that you're healthy throughout the procedure, and we're able to completely focus on what we're doing. You're not moving your head around, you're being completely still. We're able to administer just top of the line treatment and do it the best way every single time. And that's what we most commonly do in our office. So a lot of different levels there. As far as how long you're going to be asleep for. So especially when we're talking about general anesthesia, we don't want you to be under any longer than you need to be. We don't want to give you more drugs than you actually really need to have to be comfortable throughout the procedure. So typically what's going to happen is we're going to put you to sleep. We're going to do the procedure. We're going to take the teeth out, put implants in, suture everything up, get all the records that we need for our lab to be able to make the teeth the same day. And then we're going to let you wake up naturally. Now this is not like when you're in a hospital and you get like open heart surgery and they have to wake you up because they've like paralyzed your body. That's a totally different thing. That's like a different level of sedation, hospital level sedation that we're not really doing in our offices. What we do is we just stop the flow of the drugs and we let your body naturally wake up, and we let you start breathing on your own again, and we let you wake up. And it's a very predictable thing. It's very comfortable for the patient. As they're coming out of it, you do start to become aware of what's going on and where you're at. You're probably not going to remember a whole lot. Your brain is not really recording as much, but you are still awake and you can respond and we can talk and we can make sure that you're nice and comfortable. Now you are going to be numb at this time. We usually will re-administer the local prior to waking you up. So now you're still going to be numb. You're not really going to feel anything that's happening in your mouth. You just might feel a little bit groggy from the sedation. And most often patients just fall right back asleep. They're technically awake, but they are sleeping, just kind of napping things off, if you want to think of it that way. Usually for about an hour to 2 hours after that, we're making the teeth, we're making them look really nice and pretty, making sure that it's exactly what we want. And then we're putting the teeth in, and then we're sending you on home nice and comfortable so you can go home and sleep everything off and wake up the next day feeling new. And usually the recollection of the day is pretty blurry at that point. But that's what general anesthesia looks like. I can understand why people are a little bit nervous about that, because the world of sedation can be kind of confusing as far as how all the levels and what you're actually going to experience and what's predictable and what's not. For us, we find that, in the broad range, and we talked about this before, the broad range of all the different medications people can take can really modulate how that sedation really works. And so if it's just a standard dose every time, you can get kind of different reactions from patients just based off of their own brain chemistry. But when we are doing general anesthesia, we have an IV in, we're able to modulate how much drug we're giving. We can make sure we get you to a nice, safe, and comfortable level throughout the duration of the surgery.
Yeah, perfect. So I think one other thing that I would add to all that, because you did kind of like a big overview of like different types of sedation, is when you have somebody that does this pretty much every single day, like the procedure is going to go so much quicker than somebody that doesn't do it very often.
Yeah.
I know that my anesthesiologist that comes into my office and helps me out with these cases, putting them under completely, pretty much. There are situations where they just put them to sleep and pretty much they're like waking them up right afterwards because we're done with the procedure, right? And they're just like, I just cannot believe that you did that quickly.
Mm-hmm.
And the alternative to that is like you might be under for like I've heard of like 8 to 10 hours sometimes.
Yeah. Oh,
and would I be comfortable being put under for that long? I don't think I would, like, unless it was like totally necessary. And if I could find a situation in which it happened quicker so that I didn't have those drugs and I wasn't in that situation for longer, I would probably look for that. And we do at Smile Now Dentures and Implants, we include sedation as part of our case fee. So like being able to come in and the highest quality of sedation that we can offer for the offices that we're in, like we do that. So you're going to be put to sleep. It's safer, it's healthier. We can control blood pressure better. We can control everything that's going on so much better than if you're awake 100%. So.
Yeah, I mean, and that's a great point too. And one thing that does become a bit of a concern, when we're not doing or not having an IV in from the very start is, if something were to go wrong throughout the procedure, let's say, a patient has a cardiovascular event or something that has to do with their, pre-existing medical history, when you go through advanced cardiac life support, ACLS, which we're all trained on, one of the first things you got to do is A, you're going to give someone oxygen, and B, you're going to get an IV in and you can administer drugs to help take control of the situation. It is a very different situation when adverse events happen and we already had an IV and we're already providing drugs and we can control that situation on the fly versus we try to sedate someone with just pills. Now they're having an adverse event and we're trying to get an IV in and now we're under pressure and it's a moving situation, right? So, for us, we want the most predictable dentistry possible. We want predictable surgeries. We want patients to be safe and we want them to be comfortable. And for us, the only real way to do that, consistently 100% of the time is to offer this kind of service. And we didn't want that to be a financial barrier. We wanted to package things in and make it work for patients because, in the long term, it's better care for our patients, a better experience for them. And it can even mean a longer lasting prosthesis because we got the implants exactly where we wanted them to be. We got all the implants that we could possibly do with the bone that we had. And we're happy with the job that gets done. It's not being compromised by unpredictable factors like that.
Perfect. Yep. Well said.
All right. So this one's interesting. So I have been doing some reading and the internet is scary. I can agree with that. From what I gather, I am never allowed to drink again, ever. I'm 2 months post-op and it all looks like I'm not supposed to have a glass of wine. I did not sign up for that. They never mentioned it and I'm bummed. What do we got there? That's interesting.
Yeah. So when I read this one kind of cracked me up a little bit. I'm not sure why anybody would tell somebody that they can never drink for the rest of their life after getting an implant. That I've never heard that. That's not a real thing. Alcohol, it's not good to be an alcoholic is what I would say.
Yeah, naturally.
Right?
Mm-hmm.
For a lot of different reasons. And one part of that is your health. So like if you were like a pretty extreme alcoholic, getting a procedure like this, I think you have other things that you should work on before you work on, renovating your mouth. So, and then also like if you were an alcoholic, like you probably have diminished healing capacity, like because your body is probably dealing with everything else. So it doesn't have the ability to kind of focus on the healing aspect of what's going on right now. So I would say that loosely, but the concern that I always have is bleeding, afterwards. There are, I wouldn't even call them complications, but like we get a lot of people that have lived a long time, right? And part of that means that like our bodies wear down. And so we have different conditions and modern medicine has given us the ability to overcome a lot of these, but like some of those are like our blood, right? Like, do we coagulate as easily as we did when we were 20? No. Are we taking medicines to like anticoagulants to help us with our heart health? Yes. Right. And so sometimes bleeding after the procedure is something that we have to control or something that we have to deal with. And I think that when we're talking about alcohol thins the blood. So if you're drinking, it thins blood. The post-op complication could be that you're still bleeding after you should not be bleeding anymore. And that's the big concern. Can you
Yeah.
think of any other concerns with alcohol other than that?
It's kind of like what you said with, being an alcoholic is not good. Like if you have liver cirrhosis and you have like liver failure, I mean, that's
Yeah.
an extremely important organ for cleaning up toxins in our body and keeping us healthy and keeping
And,
our
and
blood
using
clean.
the painkillers too, right? Like
Yeah.
our
Yeah.
kidneys and our liver are what metabolize like
Yeah.
all the medications that we take.
Yeah.
So those need to be healthy, and alcohol has adverse effects against those sometimes too, right?
Yeah, right, absolutely. But what this person's saying about, having their evening glass of wine or what have you, if you're 2 months post-op, this is not the post-surgical period that we're talking about in the several days following a procedure. You should be healed, your gums should be closed, you're not going to be experiencing bleeding as a result of having a glass of wine. So I would anticipate this is some kind of miscommunication
Yes,
potentially
right.
between their doctor and them. I think if we're talking about smoking, that can be a very different conversation because certainly if you're smoking a pack or two a day after getting your implants, like, yes, you can definitely expect that you're not going to get the same return on investment as someone who quit smoking before they get this done. But as far as alcohol is concerned, no, I think you should, as far as a doctor can recommend having alcohol, yeah, go ahead, knock yourself out, have a glass of wine, enjoy yourself, and have a steak while you're at it because now you have these wonderful
Yeah.
things.
I usually my advice to patients is like minimal alcohol, like no alcohol in the first 3 to 4 days.
Yeah,
Minimal alcohol for maybe up to like 1 week, maybe 2 weeks
yeah,
at the most.
I agree with that. Absolutely.
Awesome. Okay. Well, good job, man.